Heart failure with preserved ejection fraction, or HFpEF, is a complex condition with limited treatment options. Welcome to our channel. Today we'll discuss the CHARM-Preserve trial and what it means for patients with HFpEF. Heart failure with preserved ejection fraction, or HFpEF, remains difficult to treat. Unlike heart failure with reduced ejection fraction, HFrEF, where ACE inhibitors and ARBs have shown clear benefits, HFpEF lacks definitive treatment strategies. This makes understanding trials like CHARM-Preserved crucial for advancing patient care. The CHARM-Preserve trial enrolled 3,025 patients with HFpEF, defined as heart failure with a left ventricular ejection fraction, LVEF, greater than 40% and New York Heart Association, NYHA Class II-I-4 symptoms. Patients were randomized to receive either Candesartan or a placebo. The trial aimed to evaluate the effectiveness of Candesartan in this patient population. Over a median follow-up of about 3 years, there was no significant difference in the primary outcome of cardiovascular death or heart failure hospitalization between the Candesartan and placebo groups. However, there was a modest reduction in heart failure hospitalizations with Candesartan. Participants had a mean age of 67 years, with 61% male and 91% of European origin. The majority had NYHA Class II or III symptoms, with a mean LVEF of 50 to 59% and an average systolic blood pressure of 136 millimeters of mercury. Primary outcomes showed no significant difference in cardiovascular death or heart failure admission. Secondary outcomes revealed a slight reduction in heart failure hospitalizations with Candesartan. Specifically, the reduction in heart failure hospitalizations was not statistically significant initially, p=0.072, but became borderline significant after adjustments, p=0.047. Cardiovascular mortality remained unchanged between the groups. This raises important questions. Are the benefits of ARBs like Candesartan due to neurohormonal blockade or improved blood pressure control? And would these benefits be seen if Candesartan were compared to an ACE inhibitor rather than a placebo? According to the American Heart Association and American College of Cardiology Foundation, AHA-ACCF, heart failure guidelines, the use of beta blockers, ACE inhibitors, and ARBs is reasonable to control blood pressure in patients with HFpEF. So while Candesartan showed a modest benefit in reducing heart failure hospitalizations, it did not impact cardiovascular mortality. This suggests that ARBs should be considered for controlling hypertension in HFpEF patients and might help reduce hospitalizations. The CHARM-Preserve trial was a multi-center, double-blind, randomized controlled trial with over 3,000 participants. Patients were followed for an average of 3.1 years, and the primary outcome was cardiovascular death or heart failure admission. In conclusion, while Candesartan may reduce the rate of heart failure hospitalizations, it does not impact cardiovascular mortality in HFpEF patients. This emphasizes the need for personalized treatment plans and further research to optimize HFpEF management. Thank you for watching. Stay informed and consult your healthcare provider for the best treatment options for heart failure. Don't forget to like, share, and subscribe for more medical updates. Fade out with music.